Good morning, good morning, good morning. I'm Dr. Tracy McClellan, and welcome to Nurse Aide Training. Today, we're going to talk about Chapter 6, which is a very important chapter, is personal care skills. This has been designed so that you can follow along in your book, in your Hartman's textbook. And if you'll join me there at page 128, we're going to talk all about personal care skills. Now, here's the thing I want to share with you about personal care skills. You are each going to receive about 6 to 8 sheets of paper that has each of the skills on it that you will be tested on. Now, you're going to learn about a lot of other skills as well, but those skills that are listed on the CNA skills checklist or sheet that has the skills, step-by-step line item on how to perform those skills will be the only ones that they're going to test you on. There will be another video talking about those skills and what's important and what's going to be required from each of you to be successful on the skills part of this exam. So let's go ahead and begin. Even though I'm talking, I do want you to be scanning in your book, looking at pictures, highlighting things, and as well taking notes as we go through. So let's get started. This particular chapter is where you really start to learn more about the hands-on. Although from day one, we started you guys off with doing hands-on skills, watching the video, training, getting up and doing. It's like monkey see, monkey do. We got to see it first. How do you do it? How should it be performed? And then we're going to give you the opportunity to get up and practice the skill before you actually have to demonstrate it to get checked off on it. So personal care skills includes daily activities that most people do for themselves. You would be surprised that as people age, the older they get, some people, not everybody, they become less able to do the normal, regular functioning activities that you need to be able to do, like brushing your teeth, combing your own hair, because you got to lift your joints up in order to do that, reaching down to tie your shoe, getting yourself dressed. Sometimes that is quite a chore. And so, what we're doing is teaching you the proper way to be able to assist the elderly in these personal care skills. It includes daily activities that most people do for themselves, like bathing, grooming, dressing, toileting, and oral care. For many residents, these tasks can no longer be done alone, so they rely heavily on people coming to assist them. So, but remember, this is not just about hygiene. It's about helping people maintain their self-worth and their dignity. So, imagine you're going to take care of a patient, and the first thing you're going to do when you get to their door is knock on the door to be sure and get permission to come in. Now, if you know it's a patient that's kind of patient does not talk much and they're not going to give you permission to come in, you still should knock and then maybe peek the door open, crack the door open, look, and then enter. But typically, if they can talk, you're supposed to give them their privacy, and they have a right to say, no, you can't come in because this is their home. You're just working there. So always knock before entering, explain what you'll be doing to them. Don't just walk in and grab up their arm or start stripping the clothes off of them and did not tell them what you're going to do. You're supposed to explain to them what you're there for, who you are, and what you're there for. Give the residents as much privacy and control as possible. That's the purpose of personal care initially. The second thing we want to talk about is bathing and hygiene. Bathing is a time to both clean and observe. So now that the person does not have clothing on, you can look at the backside to see if there's any redness on the skin, if they're starting to have craters or an indentation in their skin. And elderly people, if they lay on the side too long because they can't move, the skin will start to break down. First thing you'll see is like a reddish, redness to their skin, like a bruise almost. There are several types of baths: complete bed bath, partial bath, tub bath, showers. Um, During a bath, you want to make sure you observe the skin for redness, bruises, rashes, or open areas. There may be early signs of pressure injuries or infection. If you smell something, we know if you don't take a bath, or some people before it's time to get another bath, they may already have an odor in those key spots. But sometimes you might smell a different odor, and you know it's not the usual odor. There may be infections set up somewhere. There may be some openness in the skin. That's something you're going to notice first, and you have to report that. Always check the water temperature. Never leave the resident alone in the bath area, and keep them covered as much as possible because they lose heat through their skin. Maintain their warmth and dignity. So you want to encourage independence. If they can do something for themselves, hey, let them do it. That's going to give them some exercises, and it gives them some control over their care. Let residents watch what they can safely do and assist with the rest. Okay, that's segment 2. Now, let's talk about the third section, grooming and appearance. In one of your skills where you assist the client that has the weak right arm, you're going to be assisting them with getting dressed. So make sure you pay attention in that particular skill at all of the different steps. Because if you don't do it in the correct order, you're going to miss the entire skill itself. If you miss one skill, you fail the entire skills portion of your test. But guess what? It is very, very possible that you're going to get everything right, because you're going to do exactly what I'm telling you that you must do in order to pass the exam. And guess what's going to happen? You're going to pass the exam. So, grooming and appearance. Grooming might seem small, but it has a huge emotional impact. Simple things like brushing hair, shaving, and nail care can make residents feel refreshed and confident. Always use the residents' personal grooming items. Handle gently and respect their preferences. Give them some choices. Okay. If you're putting clothing on them, give them 2 choices and let them have some sense of control. Sometimes you feel like I'm just going to put her on this because this looks good. That's to you, but you've taken the control from the resident completely by making the decision yourself. So one of your skills tests, the steps is you have to give the resident an option of clothing items and let them select which one they prefer to put on. So it's necessary. Segment 4 is oral care. Good oral hygiene prevents infection, promotes appetite, and improves comfort. You want to brush their teeth. If they can't brush their teeth, make sure you brush the dentures at least twice a day, and always wear gloves anytime you're dealing with someone's fluid, whether it's from the mouth or the urine or stool. Always wear gloves. For unconscious residents, provide mouth care every 2 hours using a swab, keeping the head turned to one side to prevent aspiration. Now that's very important. Never place your fingers in the mouth of a resident. Even someone unconscious may bite down reflexively. So you don't want to do that. Section 5, dressing and undressing for personal care skills. When you're assisting someone with dressing, remember the phrase, dress the weak side first. Say it with me. Dress the weak side first. So, okay, picture this. My right arm is my bad arm. I have on a gown, okay? So if I'm wearing a gown, and it's the kind of gown that ties in the back, so I just have a round neck here, you're going to take it off of my bad arm first so that you can easily get it around. You're going to take it off my good arm first because I can move that arm. Take it off this side first, and then you'll be able to easily bring it around and take it off my bad arm, right? But if you're dressing them, that's the difference. When you're getting ready to dress them with the new clean garment, you're going to dress the weak side first. Say it with me. Dress the weak side first. I would hate to see you miss this on the test because you were trying to dress the left side first. Dress the weak side first. And on your test question or on your skills, the skill is dressing the client with weak right arm. So the right arm is going to be the weak arm in this particular scenario, okay? So please make sure you remember that. Always allow the resident to choose their clothing if possible. Provide for privacy by closing the curtain or door, and never rush them. Encourage residents to wear clean, comfortable clothing that suits their temperature and activity level for the day. Okay. And then the next section is segment 6, toileting and perineal care. You're going to see in your skills sheets, there are skills that you have to perform from this section. Toileting is one of the most personal aspects of care. Approach it with sensitivity and professionalism. Yes, your patient is completely naked, but you're a healthcare provider. You don't care. That's how they need to be in order for you to help them with their toileting needs, possibly. Help residents to the bathroom regularly to prevent accidents, because they don't really want to wet on themselves. It's just like a toddler. Once a toddler learns how to use the bathroom on their own, they really don't want to go to the bathroom on themselves ever again. It feels like a violation. If a resident uses a bedpan or urinal, keep them covered and make sure that they have access to call lights to call you once they're finished. When performing perineal care, always wash from front to back. Now that's key and very important. Always wash from the front to the back. How do you wash? From the front to the back, okay? That will shut a nursing home down quick if they go in and they do their annual inspection and nurse aides are down the hall wiping incorrectly. They will shut it down. So always wash from front to back to prevent infection. For catheter care, keep the tubing straight, bag below the bladder, and avoid tugging. You want to clean gently around the insertion site with warm, soapy water, following the facility policy. And there is a particular skill about how do you do perineal care, and there's also a skill on catheter care. Make sure you read line by line all of the items for the toileting skills. Make sure you respect and give them your reassurance to the resident. That's key. Your calm approach will help protect their dignity. Section 7, bed making and resident comfort. A clean, wrinkle-free bed prevents discomfort and pressure injuries. So you want to make sure you focus on that. When you're making an occupied bed, keep the resident covered and roll their linens carefully to one side before replacing them. Always smooth the sheets, remove crumbs or wrinkles, and ensure the bed is in its lowest possible lock position, okay? So the resident can't roll out of the bed. Before leaving, check that the call light is in reach and the resident looks comfortable and safe. Always looking around the area where you're taking care of your patient. The next section, maintaining skin integrity and preventing pressure injuries. The skin is the body's first line of defense, okay? So pressure injuries develop when blood flow is cut off due to pressure or friction. That's why they have a rotation where you turn patients that can't turn themselves, you got to go in and turn them every 2 hours. That's nursing care. That's one of the most essential things that we do to help with patients staying healthy. You want to reposition the residents at least every 2 hours. Use pillows to support their bony prominences and keep the skin clean and dry. You want to report any redness or open areas right away so that they can start doctoring and treating those areas. Early detection saves lives and prevents long-term complications. All right, the next section is section 9 and almost at the end. Respect, privacy, and compression for personal care. Personal care is intimate. That means you're spending private time with your resident. This is a time for bonding. It's a time for building rapport, establishing relationships, or maintaining relationship. You become a trusted confidant oftentimes to the resident. And so that's why you have people who work at a long-term care facility. If they've got a certain hall, That's their hall. The patients down that row, those are their patients. Because they begin to, it's healthy for the resident, especially because you know that whether or not the patient normally wakes up when you first go in the room and introduce yourself. You know their behaviors, you know what's normal for them, rather than switching it out every day. You got different people. It's called continuity of care, and that's a good thing for the resident. And actually, it's a good thing for you. You know what to expect when you go in to take care of your patients. So personal care, it really is intimate. Always protect the resident's modesty, cover areas that are not being washed, close the doors and curtains, and speak reassuringly. Think about it. You're there, you're lying there vulnerable. Yes, you're old, but you still, you still have a mind. You still have a mind. You still have a desire to be respected. You don't want your whole body just laying there naked and you're washing your feet. Here, cover me up. So only expose the areas that you're actually doing some care to and give them some respect. Use every opportunity to build trust, to talk softly, smile, and tell the resident what's coming next. So if you finish washing their midsection, just let them know, I'm almost done. I just got to do your legs and your feet. So have a conversation with them while you're giving them their bed bath. When residents feel respected, they feel safe, and safety builds cooperation. So that means whatever you're trying to ask them to do, they'll cooperate because you've built a relationship with them. Personal care skills, it's very, very vital in terms of being a healthcare provider. So in closing, chapter 6 is where your heart meets your hand. Every time you bathe someone, dress them, or feed a resident, you're doing far more than a task. You're restoring dignity, comfort, and confidence. Take pride in your work as a nurse aide. Do it with kindness and remember that small details make the biggest difference. In chapter 7, we'll build on these skills by learning basic nursing skills, including vital signs, measurements, and emergency responses. I'm Dr. Tracy McClellan. Please make sure that you are also utilizing your workbook. For every chapter that you're reading, you should also be completing your workbook as well. Okay? Keep studying.